Hello and welcome. India has now administered more than 188 crore vaccines. That's 1.8 billion doses, which means it covers a substantial portion of the population. Fewer have got the third dose or the booster dose or the precautionary dose, as we call it in India. But nevertheless, the number of cases are, as we all know, still low as we speak at the end of April 2022. Now, speaking specifically on the 28th of April, the number of cases are in the 3,000s, which is a low number compared to most other cities elsewhere in the world, leave alone countries. Many of these cases, at least as evidence from data that's being reported in cities like Mumbai, for example, are also asymptomatic, as in people are testing positive on RT-PCR tests, but are not showing any symptoms, at least as reported to the local authorities. Now, there are many more people who are obviously contracting COVID-19, but are not either getting themselves tested or are testing at home using rapid antigen tests, and those tests are not being reported. So therefore, the numbers are not strictly accurate, at least in terms of assessing it at a national or even a sub-national level. So the questions are really two today. One is, to what extent is the disease now prevalent, and to what extent are the vaccines or the immunity systems helping ward off the impact of COVID-19 on us? The second is, how does it look going forward? As we stand here with not everyone taking that third dose, unlike in some other countries, and maybe the spread of vaccines here on will slow down. Is it likely that we could see more impact of COVID-19 in the current form, or is this something that we've now genuinely come to live with? That's really the second part of the question. And finally, there are also other symptoms that we are seeing, including symptoms of flu, and is that something that we should be worried about, particularly if we start mistaking one for the other? Anyway, so let's address these two questions with our two guests today, Dr. Anita Mathew, physician and infectious diseases specialist at the Fortis Hospital in Mulund in Mumbai, and Dr. Rommel Tickoo, director internal medicine at the Max Super Speciality Hospital in Delhi. Thank you very much for joining me. Dr. Mathew, let me start off with you. How are you seeing COVID play out today as you do your rounds in the hospital?
So to be honest with you, we don't have a COVID center now in our hospital, and we do see some OPD patients walking in, but the numbers are not too many. So in maybe every second or third day, I might land up seeing one patient which would be COVID positive, as against most of the patients being COVID positive earlier. So in that sense, we are fairly okay in terms of the number of patients that we are seeing in Mumbai.
Right, and in amongst the patients that you are seeing, what is the kind of symptoms that you are noticing or recording?
So these are your typical viral symptoms. So they generally would have had a bit of a sore throat or a fever or body ache, but nothing really much. None of those are typical of what we used to see earlier on with COVID, like the sense of smell and taste, which had been lost. We're not really seeing those kind of patients at all. It's majorly cold, cough, fever, and occasionally loose motions. These are the predominant ones which are coming to us. 9 out of 10 patients do not require any kind of admission to the hospital, nor do they really complain of breathlessness. So, in that sense, we are seeing very mild disease as of now.
Right, and would all the patients who come to you be vaccinated? Is that your understanding?
Most of the patients have been vaccinated, yes.
And most vaccinated of them have 2 doses?
Yes, most of them have been vaccinated with both the doses. There are some who have even had COVID in the past as well. So, some of them who have had COVID in the last or the year before last wave. But yeah, right. but they are typically very, very mild.
Right. Okay, Dr. Tickoo, tell us about how you are seeing the virus present itself as and when it does today.
As of now, majority of the disease, though there are 1,000-odd cases in Delhi for the last few days, but almost all of them are having very mild disease and they're getting better on their own. I'm sure there are more cases because people are testing at home and we don't take them into consideration. And a lot of people are actually not testing at all because they believe that they'll get better in a couple of days, 2-3 days, and that's actually what's happening. So I would say we are in a good space as of now, but let's be careful, let's wear a mask because you never know when the cases will go up. But right now we seem to be in a good space.
Right. And the questioning, I mean, my questions, at least for our conversation today, is a little more centered around vaccine and its impact. So if I were to ask you about now your patients, I'm assuming that most of them are vaccinated. So would it be fair to assume from your observational standpoint that vaccines have worked and are working effectively?
Of course, yes. Vaccines have worked in Delhi. Majority of the population, eligible population, is vaccinated. And that's why they're having mild symptoms. See, we all know that vaccines can't prevent you from getting infected, but they prevent hospitalization, they prevent severe disease, they prevent death. So that's what we are saying. And majority of the people in Delhi or otherwise in our country are vaccinated. And that's why we are not facing those problems which the other countries all over the world are facing. So vaccine definitely plays a part. And now I would also insist on getting a booster dose done for those people who are eligible for it, because it gives you another level of protection. See, we all know you might still get COVID, but you will not land up in the hospital. So vaccination is a must. It has worked. At least 1 billion people have got one dose in India. As you rightly said, we've done it aggressively, we've done it well, and that's why we're reaping the benefits of vaccination. So
right. So, Dr. Mathew, you know, India started vaccinating in the second week of January 2021. And considering that, as Dr. Tickoo says, you know, we started putting up the guard against the virus only in March, April 2020, the response has been pretty fast, and we've begun vaccinating. Now, my question, however, is many people who got their first dose in January 2021, which is last year, also got their second dose, let's say between March and May last year. So it's almost a year now for many people, particularly in the slightly mid-age range group, who have not got vaccinated for a year. So how is that now? Is that something that worries you?
To be honest, not really so much, because 2 doses of vaccine also has a good amount of immune response. Of course, a booster is something that you would be really looking at, but we need to still understand that most of the vaccines, when you give it to a particular person, you do have something called as a memory T cells, the functions of which we are not really sure, and we really have not had robust data in this particular setting. I'm talking about COVID-related T cell memory response. Now, I do believe that there would be some response that the body would initiate when it comes in contact with the COVID virus. So there would be some level of protection. Whether the protection is going to be robust enough is something that I can't really comment at this particular stage. But there will be a response. So I do know that the patients will mount a response and there will be some level of protection. However, if you take a booster, obviously the level of protection is far higher. So yes, if they could ramp up the services and going ahead and vaccinating even the patient or even the people who have taken it maybe 9 months or 6 months into the last dose of vaccine, I think that will help immensely.
Right, but as someone who treats infectious diseases, what's your sense? I mean, if you could explain it for those who will watch or read this, how does the infection, or potentially how could it hit you once? Maybe the vaccine fights back, it goes away, and then maybe it comes back again, because in any case across the country we are in far greater or higher levels of exposure to people. We are attending weddings, going for movies, malls, and obviously now without masks, though that may come back. But what does that mean in terms of in terms of the way a virus could spread, and obviously our body's ability to resist it or fight back?
So we have two distinct mechanisms by which the body is known to fight against an infection. One is the response with the antibody, as what we all popularly, probably it's already there in the papers. You have an antibody related response, what we call as a B cell immune response. And you also have a far more complex response in the body called as a T cell response. Now, these T are your memory cells which stay there, and they are in a position to mount a response whenever the infection or the offending organism comes in contact with the body. And this is the mechanism by which you look at a vaccine. So that's how the polio vaccine and all the other vaccines have been prepared, with the help of the fact that this response also gets initiated once you give those booster doses. And these are especially important, and these are your normal fighting mechanisms which will come into play. So that probably is saving us from a lot more infection than what we would land up seeing with a country with a humongous population like ours. But Having said that, we need to understand that this particular virus is what we call as an RNA virus. It's not, so it's similar to HIV in a lot of ways, in terms of the fact that they can keep on mutating. That's where the similarity ends. It can keep on mutating, and that is the reason why we do not have an answer to, a final complete vaccine for the same. Right, so we may land up requiring some more shots in future, for all you know. Maybe it could be incorporated with a flu shot like we normally do for the flu vaccine. We don't know how it's going to span out in another year's time, but we do know for sure that flu doesn't infect majority of individuals. It could have a subclinical infection. That means you could have an infection which is very mild enough for you to not even show a response in the form of a cold, cough, or any kind of a symptom. So similar kind of a thing must be going on right now in the background among the community. We are not really going ahead and trying and testing each of these. So I do believe we have had a state where we do have some amount of herd immunity for the present variant at least, and that is the reason we are so far, in a better space than most of the other countries around.
Right. So, Dr. Tickoo, how are you seeing it? I mean, the fear that I'm trying to express here is that essentially, if I got my last shot in, let's say, May 2021, and I haven't got the next shot, and I'm not saying whether I will get and obviously if I get, I will take it. But regardless of that, is the vaccine working, and to what extent should I assume that it will continue to work and defend me, the recipient of that vaccine?
Well, even if you've taken 2 shots, it gives you enough protection and you won't land up in the hospital, you won't have severe disease. But again, if it's been, we all know there's enough evidence now, scientific evidence says that the effect of the vaccine wanes off over 5 to 6 months. That's why we need the boosters. So you might still end up getting an infection which is mild, but why not to boost your immunity, give another layer of protection to yourself? If you've taken the last dose in May 21, then I would say after 6 months, you should get a booster. That's how I would look at it instead of 9 months. Yes, again, we have to look at the logistics. We have to look at the manufacturing, whether we have enough doses. Right. We also have the first dose, a lot of people. But having said that, I would say we can reduce it to 6 months now, and whoever is eligible should be taking it. And vaccines, we have enough evidence that vaccines do work. I mean, all over the world. So there should be no hesitancy now when it comes to vaccines. I mean, the Covishield, more than 80% of people in India have had it. The rest of them have had Covaxin. And there's so much data. And looking at almost 1.85 billion doses having been given, I don't think there should be any argument or debate on the efficacy of the vaccines. And when it comes to the booster, yes, everyone should take it. And we are lucky that even children will be getting vaccinated now. We have 2 which have been given approval, and that's one section of the society which was not vaccinated, and soon they'll also be vaccinated. But again, in children, the disease as it is mild. We don't see too many complications in children. So overall, it's looking far better for India than the rest of the world. But again, we should keep our fingers crossed. We should keep what we are doing.
Right. So the question to both of you is that, so you're not seeing anything today or hearing of cases, let's say, coming to hospitals, even if the cases are relatively mild, which could be an outcome of reduced vaccine efficacy? Or is it too early to judge that?
I haven't seen it as of date, but it would be too early to judge that.
Okay, Dr. Tickoo?
Yes, it's too early to comment on that, but I think it does give you enough protection. Even after 5 months, it doesn't mean that it becomes redundant after 5-6 months. It gives you enough protection. But if you have a booster available, why not to boost your immunity? But it might become a norm, as Dr. Mathews earlier said, that maybe you'll have to take it once a year or so, the way you take a flu shot. And it's almost becoming endemic now in India. If you look at the last wave when we had after that, there have been sporadic cases here and there in a vast country like ours. I mean, there will be ups and downs, and we're not looking at numbers now. It's beyond that. Now we have to look at hospitalization rates, mortality, and it's heading towards becoming endemic, I would say, in India. And that's how we'll have to behave and live with it. But again, do wear a mask for the next 6 months.
Dr. Mathew, so between, let's say, immunity born out of prior infection versus vaccine, any sense of what seems to be working better in the cases that you have seen?
Obviously, there is enough data to suggest that if you have had an infection in the past, a natural immune infection, then that probably gives you better protection as against a vaccine. But that doesn't take away from the fact that the vaccine does work. I have taken my 3 shots. All the 3 waves, I've not had COVID. So what protected me was just my vaccination and the fact that the masking and the COVID appropriate behavior probably was pretty good. And of course, the grace of God, I should not negate that. But having said that, vaccine does help. Your mask, they help big time. So both of them together, I think it should be helping you. So there are patients who are naysayers who do not probably sit, they are the fence sitters who do not want to go ahead and take the vaccine, who would say that, you've said that the vaccine, the natural immunity is better. But the cost of the natural immunity sometimes is even high level of morbidity, which is severe illness and landing up in the hospital, probably requiring ventilator, and occasionally a person can die. So if you counter that, I think it's better to go in for a vaccine-related immunity rather than a natural immunity here. But having said that, all natural immunities are better than vaccine ones.
Okay,
that's across the board.
Right. Okay, Dr. Tickoo, if I were to ask you a slightly more demographically leaning question. So if you were to look at the age groups, bands of patients that you've been seeing, particularly in the last 2 to 3 months, anything that suggests that, with or without vaccine or with full dose or 2-3 doses, there are any variances in response?
I haven't seen that. See, in the last 2-3 months, it's the younger lot which is getting more infected because they are more mobile, they are going out for holidaying, they are celebrating, they go to the malls, they go to the markets, and economy has opened fully. And they're the ones who, see, the elderly are most of the time at home. So the younger lot is getting infected, but I haven't seen any difference in the response. But see, if you talk about Delhi, majority of the adult population has been vaccinated. And I haven't seen any difference in the symptoms or the presentation of patients. Even now, I'm seeing 4-5 patients a day virtually, and they all seem to be having the same flu-like symptoms. Nothing different in the last month or two. I haven't seen anything different. I haven't had even one patient who needed steroids or hospitalization. And I think almost all of them were vaccinated. So the vaccine does prevent you from getting severe disease. But yes, there are people who after vaccination have been infected twice, thrice also. But again, it behaves like flu. As long as it behaves like flu, it doesn't really matter.
And those who are consulting, would you say they're all in maybe the 30 to 45 range or 40 to 60?
Majority are in that age group because they're the ones who are traveling. They're going to Goa. They're going for weddings. They're going for celebrations, and I mean they're the ones who actually end up bringing it back home, and then the parents, grandparents get it. So eventually, it's a younger lot who gets it home.
Right, Dr. Mathew. Demographically, or from an age point of view, how are you seeing the?
Middle-aged. How are you seeing middle-aged is where we are seeing majority between 35 to, if I can call 35 as middle-aged, 35 to about 65. That's the age group that we are seeing in. We do see a lot of pediatric, I don't do pediatrics, but we do see a lot of children coming with flu-like symptoms. But since the schools have opened up completely, so these numbers did go up, and these kids have had some kind of an infection. I don't think everybody has been swabbing the kids there to really look at whether they are having COVID or it's a non-COVID flu virus. But I think some of these would have been coming in from the community there as well, and they may be getting it back home too.
Right, and the category that we saw, let's say, far more impact, which may be in the 60 plus with comorbidities, is that the segment which is still under greater threat?
That is obviously going to be under greater threat because of the age being one of the major factors, because your immune system doesn't behave appropriately after a particular age. So they are obviously going to be at a higher risk at any time point. So the older you grow, the more likely that you're going to have more complications in terms of the disease.
Right, and Dr. Tickoo, would your advice be different for, let's say, different age groups at this point of time, given that we are obviously opening up or have opened up?
See, as I said earlier, we have to live with it. Schools have opened Dr. Matthews rightly said, even in Delhi, majority of the children are bringing it back home. There's so many children who are infected. But again, all of them are getting better. They have mild flu-like symptoms. So the advice wouldn't be different. It would be the same. Whoever is eligible for vaccination, please go for vaccination and wear a mask. Yes, when it comes to children, it's difficult for them to wear a mask. But for adults, yes, definitely vaccination plus mask is what you should be doing. It's not practical to wash your hands very often or to maintain social distance, at least as of now, the way things are right now. Everything is back to normal. And we again have to live with it, and we have to accept the fact that this virus is here to stay for some time. But as long as we don't have a new variant which is mutated, is giving severe disease to us, it's fine. I mean, just take the precautions which we've been taking for the last couple of years now.
Right. So last questions to both of you, and let me begin with you, Dr. Mathew. As you look ahead, what are the kind of data inputs that you would look at to help you understand and anticipate what is coming or likely to come, whether it's the virus itself or its behavior, or for that matter, let's say, a better understanding of how the human body is responding to this virus?
So what we would need definitely is more of genomic studies. So rather than doing it, as a one-off kind of a thing, probably we need to do the genomics for most of the patients who come to the hospital with this particular disease. Maybe run some kind of epidemiological data to really look at, survey rather, to look at whether and what's happening in the community at a level where when patients are really not falling in sick. This is something that we would really need to be able to determine where are we going, where are we heading, and what kind of responses are we going to see in future.
Okay, Dr. Tickoo?
Yes, the virus keeps getting evolved more and more, and we never know when which mutation will happen and how the virus will behave. So gene sequencing is something which we have to do to keep a track of the virus, how it evolves, what are its characteristics, what are the mutations, how it's going to behave in future. We have to pick it up early. And if there's a new mutant which has hit some part of the world, we have to be very proactive. That's when we have to really proactively, aggressively take those steps so that it doesn't get back to our country. So that's what has happened earlier during the Delta wave. We were very complacent. We were not proactive. That's why it hit us so badly. But having said that, it was a bad variant. It was a bad mutant.
Right.
But right now, I think we have learned enough from our experience, from the experience of other parts of the world where people are still facing a deluge of the virus. But right now, I think we're in a good space and we should be taking those precautions and keeping a track of the virus. Be vigilant. We don't have to think that it's dead and gone. It can anytime come back. A new mutant, monstrous mutant can hit us again. So keep at it.
And there's nothing, I mean, is there anything, for example, in local data that you would like more, just to understand how things are moving, and whether either in the public health context or even in a very clinical context?
Nothing really. I don't think there is any data which tells us how the virus is going to behave in future. That's something which nobody can predict. So that's why we have to be at it. We have to take all the precautions. We don't know. Maybe my gut feeling is that over a period of time, the virus is sort of becoming weaker and maybe it will eventually die down in the next 6 months. It's not going to be there forever. So 6 months, 8 months, and gradually maybe just get out of the country, get out of the world. So, but till then, we have to keep at it. We can't get complacent, but I don't believe in these mathematical models that there will be a fourth wave in June, there will be a fifth wave in October. I don't think anybody can predict these waves. Nobody could predict Delta wave. Nobody could predict Omicron wave. So how can they predict that at one particular point of time have a wave? So actually nobody knows. So we'll have to see how it unfolds in the next few months.
Right, and as both of you have emphasized and re-emphasized, taking care is the most important thing, even as you try and understand, or we try and all of us try and understand how this virus is going to keep living with us, even as we live with it. On that note, Dr. Mathew and Dr. Tickoo, thank you very much for joining me.
Thank you.
Thank you for having us.